Um, okay, so why did you start ozone therapy?
Basically, I was getting exhausted around 3:30, 4 o'clock at night. I would come home after work, and I honestly thought I had HIV. I thought I had AIDS or something really, really insidious or even worse. So I went and got a barrage of medical tests, and all my blood work came back for the standard stuff that we all have. That your immune system can keep in check so many things. And I basically was suffering. I had extreme exhaustion. My eye was twitching a mile a minute. I had migrating joint pains, and at like 4 o'clock in the afternoon, I felt like a veil of consciousness was just starting, like a curtain was coming down. And I would say to my wife, "I love you, honey, but I'm going to bed." And I was like 35 at the time, and going to bed at 4 or 5 in the afternoon.
What do you mean you were 35? You're 28 now.
Right, very
No,
funny.
he's not. No, he's
Very
not 20.
funny.
All right.
But back then, I felt like an invalid after 5 p.m. And I used to be able to stay up till 9 o'clock, watch my shows, and do my running of stuff, do some emails to midnight, and I was just losing all that aspect of my life. And then what had ended up happening is it started to encroach upon the good parts of time, where I had my best hours in the morning. I would wake up kind of refreshed after a night of sleep, 9 to 10 o'clock. About 11, I would start to feel it like coming on earlier and earlier. And at that point, I just started going to every doctor I could go to figure out what was going on. And I went to Dr. Visconti in Staten Island, who's a really good infectious disease specialist. And among everything that I'm suffering from, Epstein-Barr virus, all the stuff that we have, the thing that stood out the most was my Lyme titers. They were off the chart. I did a regular Lyme test, which is part of any diagnostic lab workup, but there are different specialized Lyme tests that you can do that test for the amino acids of the virus. If you're really serious about going after it, you have to do the more advanced testing, because you may have a strain of Lyme that comes from a certain type of bacteria that the regular standardized test, they're just not going to pick up. So you might think, oh, it's a false negative, because I really had very high titers for different amino acid chains of different things. I also had Babesia, which is another tick-borne virus, and Bartonella. So I had the 3 tick-borne viruses as like a triple threat. And of the titers on the blood work, those 3 were the highest of everything. And then everything else was like a secondary symptom for me. When the Lyme and all those 3 viruses started to push and push and push, all the other things came out as well. Now, I was given 500 milligrams of amoxicillin to take 3 times a day.
500
Milligrams
of what?
of amoxicillin, an antibiotic.
Okay.
500 milligrams. So it's 1,500 milligrams a day I was taking. I was
Orally?
it. It was disgusting. I mean, it was so much high dose of.
Was it pills?
Yeah, of pills, oral pills. And after 6 months, I went back and got my blood work. My Lyme titers were still very high. I had some success with the Babesia and the Bartonella. They went down a little bit, but not cured, not gone, still in my system. And now I had a horrible yeast problem because I just did 6 months of antibiotics, and I was starting to get athlete's foot and a whole 9 yards. So at this point, I'm a little frustrated because I just, I felt like I spent 6 months of my life trying to get better, and I opened up a whole nother can of worms. I had a little bit of relief from the Lyme. My eye was still twitching, my joints were still aching, I was tired all the time. Instead of going to bed at 5, maybe I went to bed at 7. I got 2 hours. Wow, that's not help though. And certainly I wasn't happy with it. So I had oral surgery at the time, and because of the Lyme, I had a open wound in my mouth that would not close. I had so my dentist, my oral surgeon said, I would love to send you to a hospital for you to have hyperbaric oxygen therapy. And I was like, well, how much is that going to cost? And he's like, it's hugely expensive. And I found out it was like $1,000 a day for each daily treatment. And I would need to do it for an undetermined amount of time to see what kind of benefit I could get from it. So that's where the oxygen link clicked for me. That was like, okay, all right, let me research this. What's going on with oxygen? Why is it good? And in my search and travel and things like that, I ended up buying my own hyperbaric unit for the house. And it cost me about the complete setup with the hyperbaric chamber that goes to 4.2 psi and has an oxygen concentrator. It cost me about $13,000. $13,000, but the best money I ever spent, because 8 years later I still use it a couple times a week. I'll talk to you about that in a minute. And I really just wanted my dental surgery, because I'd already had 6 implants done, and I'm just trying to resolve the accident. But what I found out was Lyme was not letting me heal. So this open wound in my mouth, anything I would eat, I was coming in contact with bacteria and food. You know, I'd go out to eat, and it was becoming a real nightmare for me. I bought the hyperbaric unit, and I started doing morning and night, 12 hours apart for a 1 hour duration, while breathing 100% oxygen in the chamber. The PSI on the unit was about 4.2, and what that did was give me about 250 to 400% more oxygen absorption for the hour that I was in the unit itself. In the first week or two, I felt no difference. I was so sick. It's like, okay. But after week 2.5, I had like a semi-awakening. It was like, I remember being on the couch watching TV at 8 o'clock. 8 o'clock was a big number for me. I was like, what am I doing awake? And it was at that point that I realized that the oxygen therapy was helping me. And what it was doing was, Lyme hates pressure, and it also hates oxygen. So the pressure and the oxygen was forcing it into remission, but not killing it.
So you said PSI. This is a number for the
The
pressure?
Lyme spirochete, B bugged it off, the whole long name. I'm not going to go into that. It's very susceptible to pressure and to different kinds of amino acids binding to it, and ozone disrupting. And we'll talk about that, how I ended up getting into ozone therapy.
PSI, this is
pounds per square inch. Yeah.
Power per square inch.
Pounds per square inch. So 4.2 psi is like being maybe 30, 40 feet underwater. That amount of pressure.
Oh, okay.
It's not high, like a medical grade unit in a hospital will go up to like 7.2 atmosphere, which will be like probably 23, 30 psi, and they're pressurizing you with 100% oxygen. But at $1,000 a pop, it wasn't a viable option for me. So, you know, I could do 13 treatments with the hospital and still be sick, or do what I did, which put $13,000 into my own unit, which now 8 years later, I love it. I'm a martial artist. I get beat up in tournaments. I go do a dive. I heal up like twice as fast as everyone around me. Let me talk about the therapy for a second. So I was doing, after about 3 or 4 months, 2 times a day, hyperbaric oxygen therapy, breathing 100% oxygen. I really was starting to feel like myself again. But I did some research, and I came across a doctor in the city, and I'm not going to name names just for confidentiality. But this doctor in the city was a specialist with direct IV therapy for ozone. And I was thinking at that time, well, I'm having such great success with the hyperbaric, why not start to go at this thing at the bloodstream? And during the time, I researched a lot about Lyme to find out more ways I could fight it and help boost my immune system. And some of the things that I found out are, one, that it gets in your bone marrow and it gets in your brain. So Lyme is not just traveling around your bloodstream, it's also lying dormant at different places in behind your blood-brain barrier in your brain and in your bone marrow. And these are really, aside from your brain, which is the high blood flow area, but your bone marrow is a very low blood flow area. Now it does get blood, but what happens is, when I did the hyperbaric therapy, it pressurized. Now it got it out of my bloodstream, but then it backed into behind the blood-brain barrier of my brain and into my
bone marrow.
My bone marrow. Now, anytime I stopped, if I missed a few days of therapy, boom, it would rush my bloodstream and start to propagate, and then my eye twitching would come back. I would start to feel exhausted in the afternoon